And we're live. Thank you so much, everyone, for tuning in. My name is Claudia. I'm an organizer with UnRestrict, and my pronouns are she, her. I'm here with Alyssa and Natalie from Family Tree Clinic, one of UnRestrict's community partners. Natalie, do you want to go ahead and introduce yourself?
Yeah, thank you. My name's Natalie Crowley. I am the Associate Executive Director here at Family Tree, and I use she, her pronouns. Alyssa?
And my name's Alyssa. I am the Executive Director at Family Tree and have the deep pleasure of working with Natalie, and I use she, her pronouns.
Wonderful. Thank you so much both for doing this interview with me. So my first question is, just tell us a little bit about Family Tree Clinic's history and place in Minnesota. What does Family Tree Clinic do, and what would you like UnRestrict Minnesota supporters to know about Family Tree? Natalie, I'll pass it to you.
Sure. So Family Tree has been around for 50 years, actually 50 years this year. We started back in 1971 as a community response to an STI outbreak. And have grown since then. So Family Tree started out as a sexual reproductive healthcare clinic, and that's kind of where our roots are. Over the years, we've added quite a few things to our repertoire, including gender-affirming hormone care, really focusing on offering kind of relevant and comprehensive health care to all people, focusing on LGBTQ experiences, and really kind of being really responsive to the community, whatever the community needs. We also have an amazing education program where we teach sex ed and just about sex in general to all sorts of folks, everyone from little kids all the way up to our elders and older adults. But we do a lot of work in the St. Paul Public Schools and other public schools. We have our deaf, blind, hard of hearing department as well. So we have deaf staff members who serve the deaf community as kind of the premier and only deaf-led program, sexual ed program in the United States, which is really cool. They also do some amazing advocacy for folks in our clinic and then actually around the state as well. Are there things that you would want to add just about Family Tree? I'll give the rest of it to you, Alyssa.
That's such an awesome overview of the breadth and depth of what we do. And yeah, and I feel like what you're saying, Natalie, a growing part of how we see our contribution to health equity is through training. So really recognizing, and especially training rooted in the belief that that critical connections and relationships are a route to a practice of kind of health and wellness in healthcare rather than disease and diagnosis, and that our communities have the solutions for their own health and well-being. And a part of our training methodology is to kind of walk alongside folks on their journey to health and really train providers to have that sort of mentality rather than I'm coming in here to diagnose you. And that's something that that we would love to do a lot more of. And maybe we'll talk about that more later.
That's really beautiful, and happy anniversary. Are you doing anything special to celebrate?
Ooh, well, fancy you should ask. Family Tree has been in a multi-year process actually to build a new trauma-informed, art-infused, community-centered health center, and we will be opening it and celebrating our 50th anniversary at the same time. So in November, we're opening our new facility at 1919 Nicollet Avenue in Minneapolis. It's our third largest patient growth zip code over the last few years. The facility will have capacity to serve upwards of 33,000 people a year, and the timing is really kismet with this next phase for Family Tree, the next 50 years.
That's so exciting. Congratulations.
Thank you.
So My next question for you is, what is your vision for reproductive justice? And I'll let either of you take it.
That's a big question. Because reproductive justice is so big, and I think that's how Family Tree comes to it. So we come from all different angles. I mean, obviously, we're like a sexual reproductive health clinic. We do birth control. We do, family planning. We help kind of talk people through preconception kind of thoughts and ideas. So that's a huge part of what Family Tree is that part of it as well. But we see, reproductive justice being like far bigger than just birth control pills and condoms and family planning. We think that also racial justice is important, gender justice, and things around gender identity, sexual orientation, all of that is also just tied into reproductive justice. So what we want is a place where everyone can have control over their own body and control over their own lives and control over their own family, like when and why they want to have a family should be up to an individual and not up to other forces in their lives. So things like food security, housing security, access to healthcare, safety, public safety, just being able to live as a safe person in this world is all reproductive justice for us. So it's a huge process and a huge goal, but I think that's really kind of part of the blood of Family Tree Clinic is to try to see that vision of a place where people really can make a choice on their own without other influences.
Mm-hmm.
Anything you'd add, Alyssa?
I love it. Yes.
It sounds like you're also going like a step beyond and affirming people's choices, which is really, really important. You lose a lot when like someone's decision to be a parent because of their circumstances isn't affirmed, especially among vulnerable communities. So kudos to you for doing that work.
It's really beautiful. Yeah.
I think that's really, a kind of unspoken part of a lot of work is that really being there for people and supporting people in their circumstance right now in whatever choice that they're making. People just need support and need to know that what they are doing is right for their life and their circumstances.
And what challenges did the pandemic present for Family Tree, and how did you adapt?
Yeah. Wow. I mean, boy, so many profound challenges. I feel like we're in a little bit of a moment right now. Natalie, curious if you would agree of kind of reflection on what this has really been like and sort of like taking stock. And I think like a lot of folks and organizations then considering what are the, not only like the lessons and things that were really illuminated, but like actually the positive changes that we really need to kind of fiercely protect and carry forward from this time, because it has been profound. And pandemic, I mean, a time of, reckoning and I think kind of like rapid active transformation in a lot of different ways. But, we had to implement telehealth in a matter of about a week and a half in April of 2019. Was that when it was? Could that be, or 2020? Now the years are all confusing. And then through the implementation of telehealth, one of the things that we know but was really illuminated is like, dang, we could have done this a long time ago. And boy, do we have skills in doing this kind of innovation. And the biggest limitation is the system that we operate within. Yeah. What would you say, Natalie?
I think definitely the telehealth thing is huge. I think also how we, and it goes along with telehealth, but really asking those questions around where people are working, like who we need in the office, why we need people in the office, why we may not always need people in the office. So really looking at how we can offer that flexibility going forward. And then what part of family tree is really having all these wonderful people, these very beautiful people in our same space. So again, I think that's kind of asking those questions and looking at the opportunities that the pandemic has given us, and what we want to protect going forward. So that is potentially offering people some flexibility in where they work, how they work, and then offering our patients the ability to do telehealth. We see patients from a 7-state area, and it's been great for a lot of them that they haven't had to drive 5 hours to come for an appointment. Even though people enjoy that, I mean, it might be nice to get out of North Dakota for a while and come down to Minneapolis and be part of this kind of queer community that we have here. But at the same time, that's a long drive um, to be doing, several times a year, a couple times a month sometimes. Um, so yeah, I think that those are um, yeah, really big things that we learned from the pandemic. Um, yeah, and also just how to work together and do things really quickly, like that, like making huge changes, pivoting quickly in a week and a half to things that are completely out of our control. Um, Knowing that we might drop balls or make mistakes, but we're gonna pick those balls back up and fix those mistakes later. So giving ourselves that grace, I think that is
Mm.
kind of shows our ability to adapt. And as we do bigger projects like moving into a new building, I think that gave us some skills that we're going to be using in the next few months.
Yeah. Yeah.
Beautiful. It sounds like you're part of a really incredible team. How do you build and maintain that culture?
Yeah. Boy, it's such deep work. Go ahead, Natalie.
Oh, yeah, it is. It's really deep work, and um, there's a lot of work and a lot of commitment that goes into it. One of the things that I love working at Family Tree is that I know that everyone who is here because they're passionate about the work that we're doing. Um, it is a job for everyone. Everyone's getting paid, but they're here because they want to be here. And so that's really important. That has to do with the work that we do and the people that we serve. But another part of that is really something that we've been working on for a while is making sure that our staff are representative of the people that we're serving and that we're striving to keep all staff in leadership positions on the board of directors and we've been working to try to get providers who also match the populations that we want to serve. It's not easy and it's hard actually to find those people and to keep them around, but that's one of our goals is really to create a community that looks like the community we're serving. And I think that gives us a lot of the skills that we used over these last 14 months or 15 months um, to kind of change how we do business and how we provide healthcare.
Yeah. Yeah. And we like really think and talk about a culture of care, and like a culture of belonging. And I feel like one of the things that's such a struggle for us at Family Tree and that the staff really like share a value around is wanting an environment where we can hold a lot of complexity and grace. And where people's like the kind of fullness of one's life can be respected and honored and recognized. And in healthcare, that is really, really hard, you know, thinking about ensuring that people can take time away, and that we are able to, you know, offer especially frontline staff the opportunity to step away from being a frontline staff person. And then what does that mean, you know, and sort of navigating how we hold our mission externally towards patients that we are providing care to and with, but then also internally as we care for each other as a staff. And I wouldn't say we've landed on like, you know, solutions. We're just like really invested in the conversation and trying to navigate it as we move together forward.
Yeah, just to dig in a little deeper, you mentioned earlier that you aim to be trauma informed as you're providing care. Could you share a little bit more about what that means?
Yeah, I mean, I think trauma informed can be a kind of a buzzword that stops meaning anything. And so we practice it in a lot of ways. You know, some of the kind of what could be perceived as simple but very powerful ways that we have practiced trauma informed in the context of the new building design is to center wayfinding throughout the building, to center kind of like being able to locate yourself in the building and know how to get in and get out, to have access to natural light and views to the outside, to consider health at every size values in the furniture that we're putting both in the waiting room and in all of the exam rooms. And then I think, you know, kind of more deeply to have staff who are also representational and interconnected with the communities that we serve inherently infuses a trauma-informed approach into who we are and how we approach the work. What would you add to that, Natalie?
There's a lot of like holding complexity again. Like we hold a lot of complexity at Family Tree, but part of I think being trauma informed is one, knowing that the people that you are serving have and are experiencing trauma. The folks providing the services have also experienced some of the same trauma, depending on who it is. And then as a healthcare provider and part of this larger, you know, healthcare system and nonprofit system, we as an organization can cause harm as well, and will cause harm as well. And our goal is to minimize that. You know, we don't want to cause harm, but we know that we will. And so, so the things that Alyssa mentioned are there to mitigate that, mitigate the harm that we're causing to our patients and to our students, and then also to our coworkers and each other, to ourselves. They're all there just knowing that that is there and that that's going to happen and that this trauma is in our community, but with that goal of not causing harm, even though we know that's probably impossible to do given our current situation.
Yeah.
Thank you. How are the people Family Tree represents affected by Minnesota's abortion restrictions?
Yeah, I think one of the biggest ones is we are a APRN-led and staffed clinic. So our providers, medical providers, can prescribe all sorts of medications and do all sorts of things, but yeah, they can't provide medical abortions, and so that's one of the biggest the biggest things that our patients might see or might notice as part of Family Tree Clinic. All people in Minnesota are going to be impacted and affected by our abortion restrictions here. Again, we see people from all over the state, and access in different parts of the state is super limited.
Mm-hmm.
Yeah, what else would you add, Alyssa?
Yeah, I mean, all of that. And I think, you know, broadly, like the reality is that abortion is a human right and it's a fundamental part of healthcare. And any limitation to access, whether it be waiting period, whether it be the ridiculous proposals to over kind of legislate clinics who are doing medical care and with zero lack of science or evidence. I mean, all of it is set up to kind of breed lies. And we already have a healthcare system that is kind of rooted in disease and like a fundamental approach to healthcare that isn't about health and well-being. And so any of the, I forget how many abortion restrictions are on the books in Minnesota. What's the number, Claudia? Is it like 28 or 42 or 16?
I am actually not sure. I know that like over 400 have been introduced, like not passed, but introduced since like the mid 90s. But there are quite a few on the books right now, particularly affecting minors.
Yeah. I mean, the reality is like, holy crap, there's so much work we have to do. Like, we have the worst health disparities or the second worst health disparities in the country. And we're going to waste our time creating legislation that is rooted in a lie when we already have so much work to do towards a healthcare system that's actually about health and well-being. And now I'm embarrassed that I don't know how many abortion restrictions are on the books because UnRestrict absolutely knows.
I was just going on the website on my phone to see.
Were you? Oh, good.
I'm in the same boat. I should 100% know this, and I can't recall.
Which speaks to why UnRestrict is so important in educating all of us about how many actually are there. And then to your point, Claudia, of how many are introduced regularly. I mean, it's like unbelievably outrageous and disgusting. We have more and better things to do.
Yeah, definitely. There are full-on abortion bans that get introduced every year. So it's a lot. So can you tell us a little bit about the significance of Pride for Family Tree Clinic and how you'll be celebrating? Kind of shifting gears here.
Yeah.
The significance of Pride. There's so much. I mean, the biggest significance of Pride is the vast majority of the staff at Family Tree Clinic identify somewhere in the LGBTQ plus spectrum. And so, yeah, it's really important to all people here. We want to always remember that Pride was a reaction to police actions against trans women of color, in particular in New York City. And that's really important to lift up every moment that we can, especially here in Minneapolis, as we've been dealing with the way that Minneapolis police interact with our communities of color. That Pride was the same thing. And I was just actually looking this morning at an article about Germany, but it's called the Christopher Street Liberation Day is what they refer to Pride as, when trans women of color liberated the Stonewall Inn, and I love that idea. I think we should change it to that. But anyway, so that is important to just remember the history where, and then the fact that a lot of our staff and a lot of our patients as well identify as LGBTQ and others. So it's important, and it's important to be out there. Providing care to queer folks is a huge, huge important thing. When we talk about reproductive justice, part of that is like leaving no one behind, and queer folks have been left behind in medical care for forever. And so making sure that people have that access to quality medical care, that people have access to gender-affirming hormone care is important. And so we want to be as upfront and center and providing people those services as we can. Given the kind of ongoing nature of our pandemic and our real kind of commitment to making sure that people are safe. We're being a little bit careful of what Pride celebration, Pride events we're doing. But we are doing a lot of things. We have an art show going at our clinic. So if you're coming in for an in-person appointment, you can see that. There's actually an event on our Facebook page later this week that's around art. We love doing art. And so there's a lot of those little things that we are doing in celebration of Pride this year. Is there anything you would add in our thoughts around Pride?
No, that's beautiful, Natalie.
That's really incredible. Really amazing. So tell us about how people can get involved with Family Tree Clinic. What are typical volunteer activities?
Yeah, well, I mean, we really like to highlight that a great way to get involved is to be a patient at Family Tree. We welcome just the broad community of folks who can get access to sex positive, holistic, really inclusive healthcare at Family Tree. And one way that is, wonderful and is for folks with insurance to get access to care at Family Tree. And I know I've talked to people who worry that, like, am I taking up a slot if I'm doing that? And the reality is absolutely not. And just really encourage everyone to have an abundance mindset about getting care at Family Tree. We are in a capital campaign right now. So to open our new facility in November, which is under construction and will open, we're raising $8 million. And so we're at 6.4 million on our way to 8. We are at a stage in the campaign where we're really looking to broaden our network of supporters and champions. And that can include making a donation to the campaign in any amount. Really does move the needle. I know when we're talking big numbers, it can start to feel like, what will my $50 or $10 contribution do? But it really is this like kind of fitting together of an incredible volume of people as a grassroots organization that are making this whole thing possible. And we're also looking for champions who might help us just connect and get the word out that we're moving, we're going to have expanded capacity. Are there organizations you think we should be more deeply partnering with? So a way to get involved would be to reach out to Natalie or myself or our community engagement team with thoughts on more folks to connect with. And then we do have volunteer opportunities. They're still a little bit limited in the context of COVID and how we're trying to preserve on-site staffing for folks who absolutely have to be on site right now. But in the new building, we're going to have a lot of volunteer opportunities, probably folks to greet people as they come into the building, people to help with administrative tasks in the building. And then we do have a patient education volunteer program. It's not doing on-site patient education right now, but Elle Wild is our patient resources manager and oversees our volunteer program. Their info's on the website and folks can connect with them to learn more about those volunteer opportunities. Yeah. What am I forgetting, Natalie?
I think just to keep an eye on our social media and website for opportunities, whether that's with us as Family Tree or with other organizations, partner organizations. We might be sharing opportunities to volunteer or assist in other places.
Yeah.
I was also going to go back to your, yeah, just telling people come into the clinic, just have a book an appointment. I think we've all been guilty of over the last year putting off some of those medical appointments, especially for the appointments we're not that excited about. But the number of times that I hear people say that our providers have provided the best pap smear they've ever had, or that patients feel joy when they're in our clinic, tells us that you're going to have a great experience. And so you should come on in and trust us with your care. Yeah.
Awesome. And you already mentioned a few upcoming events. Is there anything else that you would want people to keep an eye out for? Any other events?
Well, I do think, like Natalie said, following us on social media is a great way. There's so much going on being led by the amazing staff at Family Tree and in partnership. So keeping an eye on our social media channels is a great way to stay plugged into events. We do, if you're not signed up for our newsletter, please go to familytreeclinic.org and sign up. We don't have a date scheduled for the grand opening at the new facility, but we will be sending out the date probably in the next couple months. And we really want everyone to come celebrate the opening of this new building. So yeah, stay in touch, sign up for our newsletter. Natalie, are there any upcoming events you'd want to make sure to highlight?
Kind of blinking on anything, but again, the social media is the place to be. Just kind of like our page on Facebook or follow our Instagram account, and you'll get updated pretty regularly. And then yeah, our newsletter is also a perfect way to get good old-fashioned emails about things. So
yeah.
Very good. Well, that was all the questions I had for you. Are there anything else that you'd like to share with UnRestrict supporters?
Boy, I just through our involvement with UnRestrict and the coalition, and just this conversation and really thinking about what has COVID illuminated, I just feel like the thing to share is just the reminder that it really is about the power of connection, and relationships that's moving this movement forward and really enacting change. So just through these individual connections and I just see so much kind of profound, inspiring leadership coming through UnRestrict and this broad network that we have. So let's keep doing it. Systems shaking, change making, we got this.
I love it. Awesome. Well, thank you both again so much for interviewing with UnRestrict.
definitely, thank you so much. So it was a great time. I always enjoy talking with Alyssa, with other people. So
You too, Natalie. I love this. Thank you, Claudia. Really appreciate it.